Hi, I'm Jeff Ray, your host for Economic Outlook. I want to welcome you to our show. Thank you for joining us each week as we discuss the people, the companies, and the projects driving the region's economic growth. Research shows that employees in good health are more likely to deliver optimal performance in the workplace. That is, employers focused on the programs and facilities available to help their workers. We're talking about all things health and wellness in the workplace coming up on Economic Outlook. Employers know that healthy employees not only have better quality of life, they also benefit from having a lower risk of disease, illness, and injury, as well as increased work productivity and a greater likelihood of contributing to their workforce and their communities. We're diving deeper into employee health and wellness and looking at some great community resources to help employees live healthier lives. Joining me for that discussion are Denise Peters, the Chief Operating Officer of the YMCA of Greater Michiana, and Andy Qualls, the Account Executive at Onsite Health. Welcome, guys. Thank you for being here today.
Thanks for having us.
Yeah, I appreciate it. Kind of a fun discussion today. Before we really dive a little more into health and wellness, though, Denise, we'll start with you. Just give us a high level for folks who aren't familiar with the YMCA of Greater Michiana. Tell us a little bit about what you do.
Yeah, the YMCA of Greater Michiana. So we're across the region. We're in 4 different areas. So we're in South Bend. We're also in Niles and Niles Buchanan area, the Benton Harbor St. Joe area, and we also have a camp at YMCA Camp Eberhart up by Three Rivers. So we do a multitude of things for people from birth and to their senior life.
Yeah, so let's stick with that for a quick second. So, because I think folks, like I grew up in the Y, I learned how to swim in the Y, some of those things. Just give us a feel for some of the different kinds of ways that people use the Y.
Oh my goodness, that's a lot.
Not the whole show, but yeah, just a high level.
All right. People say all the time,
Yeah.
Oh my gosh, I didn't know the Y did all that.
Yeah.
So yeah, we do, and when you come into the YMCA, just the energy that you feel. So you have, we have child care, we have child watch where when people come in to exercise for health and wellness, we have aquatics. We also have chronic disease prevention and management. So people that come in with a cancer diagnosis or something like that, we have programs with that, help people manage their blood pressure. We have a lot of senior programs, aquatic exercise, multiple exercise health and wellness programs.
Great, well, sounds good, and we'll get back into some of that. So Andy, come your way. So if somebody isn't familiar with Onsite Health, tell us a little bit about what you do.
Well, as an account executive with Onsite Health, Onsite Health was founded in 2005 by our CEO, Connie Bryan. She's a registered nurse, and she worked in occupational medicine for a number of years and saw that there was a clear need to bring some programs into employers to promote the health and wellness and education of the employees. And it really, our mission focuses on long-term changes to the individual, but for the employer, a reduction in the ever-increasing healthcare costs that we all experience year over year.
Yeah, so Andy, let's stay there for a second and talk about healthcare cost in particular. I think as I'm talking to employers around the area, it's one of their biggest costs. It typically goes up. You can shop it around, but the honest truth is really the only way to bring your cost down is to have a healthier workforce. Just give us a general state of kind of cost and what's happening in the workforce right now.
Yeah, I think year over year the costs continue to rise. We've got healthcare networks that are driving some of that. We've got self-insured employers out there that are really having a difficult time trying to find those points of savings or maybe changing some of the typical spend. And what we try to do is bring in programs to really help them mitigate cost. It's the costs that you don't spend. Right? It's the dollars you don't spend that make a tremendous difference on your bottom line, and the health expense is typically the second largest in an organization and can have a real impact when the health and well-being of the individual employee hasn't really been recognized. We're looking really for those kind of ticking time bombs, if you will. Connie's mission has always been to promote the health and wellness of the individual. And it really is one of those win-win situations where the employer is benefiting. Their ROI is realized pretty quickly, and the employees are pretty grateful to have that benefit.
Great. Denise, let me come back your way. So as we're as Andy's talking about what's happening in the workforce, you in our intro talked a little bit about just sort of some of the facilities, programs, things like that. So give us a general, like, are people more inclined to come take advantage, less inclined? Did the pandemic change some of that? Give us the general state of our people. Is this on Joe Public's mind, and are they working to be healthier?
Well, people are coming back into it, and I think people are hungry for that camaraderie, to be together and to have that energy and that synergy that you get togetherness. So even in the workforce and in the workplace, where the corporate wellness programs or different programs to help bring wellness and stress management, relaxation techniques to help people to manage their stress in the workplace or about the workplace. So yeah, they come together, and I think in the facilities, but also the Y is outside the facilities at the same time. And so I do think that people are hungry for that. They want that camaraderie together. I think we look at that social cohesion piece, and I think that that's huge, and we're really working toward that with our community partners.
Yeah, and so I'm gonna stick with you for a second. So it's interesting. There's a little bit of an expectation sometimes that you be all things to all people, right? There's a program for all kinds of stuff. So how do you pick the kind of things that you focus on to help the community from a programming standpoint?
Well, that's very strategic. So we don't like to just be a flash in the pan. We want sustainable programs. So we look at and work with our community partners for that community health needs assessment to find out what it is that we need to do and where the gaps are, and who are our community partners that we can work with to collaborate to use our resources more efficiently. So we look and see how can we partner, who are our community partners, where's the collaborations that line up to meet the community needs. And there's a lot of gaps in our community where we have so many people doing so many wonderful things. If we can come together and identify where the gaps are, I think that's where we step in. We're very collaborative, and I think that's one of the natures that we have that's very beneficial to our communities.
But by way of just a quick reminder, how long have YMCA's been around serving either the local community or even national? It feels like it's been a long time.
Oh, the YMCA's have been around a long time, yeah. About maybe since the 1800s,
Yeah.
but in this community, I think 200 years, and I think Camp Eberhardt's over 100 years old.
Wow.
You have the Niles facility is, nearly 100 years old, Benton Harbor St. Joe at the same time,
Wow.
so they've been around a long time.
Yeah, it's interesting to walk in, and they feel brand new, but they have been serving the community for a long time, providing great service. Andy, let's come back your way. So this is an interesting battle for employers, right? Like, I'm very focused. I need my employee to make widgets and be done, and I'm going to pay them to make widgets, and they need to make so many widgets while they're here. But employers in recent years have understood they need to play more of a role in this. So talk about how you convince an employer who hasn't played in that space to think more about health and wellness.
Well, it really, the retention of employees is such a significant issue out there in the world right now. It's a tough marketplace for recruiting. Manufacturing sites in particular, they kind of feed off of each other. If one industry has a downturn, then those employees may, be, captured by another employer. Manufacturing is, in a lot of cases, it's a little bit of a dangerous environment. So you've got the needs to have an extra eye, extra ear, to watch out for the employees. The management of these organizations are typically, they're pretty siloed in their when they're looking for their KPIs. They're really looking for a return on investment in everything that they do. Health is one of those things, and it's often overlooked. But I think it's kind of an intentional latent pain point that's out there in the perimeter of their world. Is it an HR problem? Is it a safety problem? Is it a CFO responsibility? So that's one of the things that we do, is try to bring everybody onto the same page, and you can very easily show that it does contribute to the retention of the employees. It does contribute to better management of work comp injuries, and it does bring that ROI back from a financial standpoint.
Yeah, we hinted it in our opening about productivity. A healthier worker is more productive. Talk first just a second about role models, if you will. Don't have to name specific companies, but the companies who do this well? What are some of the characteristics that they do that others could learn from?
Well, I think a general sense of the nutritional impact, even in the workplace. So the vending machines and things like that people are using on breaks, not always the best quality food. There may be a food truck or two that comes by to serve the employees that might not be the healthiest food option for them. Also, in the workforce, you've got just the general population. It's an aging population, and there's some significant issues associated with aging that bring about some high risk rates. Those risk rates, once they're identified, then you can provide that education and coaching to promote the individual to have a better state of health.
Sure, great. Guys, we're going to take a quick break here in the studio. We're going out into the field. George Lepin-Yotis, my co-host, is out to give us an inside look at some programming happening at the Y. George, let me toss it to you.
Thanks, Jeff. I'm in Niles, Michigan, and I'm joined by a good friend of mine and colleague, Mitt Drew. Mitt, thanks for being with me today.
George, thanks for having me.
So, Mitt, tell our viewers a little bit about our relationship. You are a local attorney here in Niles, is that right?
That's correct, and I've been practicing since 1999, and you and I have had the opportunity to work together on a number of occasions. My practice is here in Niles, out in Longmeadow, and we have offices that serve the entire region, Michigan and Northwest Indiana.
And so, like many of us, you do more than just that in your world, and you like to give back to your community. You also have a secondary title here at the YMCA. Would you tell us a little bit about that job?
Yeah, very excited to be the Chief Volunteer Officer for the YMCA of Greater Michiana. Been a lifelong member of the Y. My family is a member of the Y and continue to serve as a volunteer in that capacity.
You started your role here, you told me before we went on camera, about 15 years ago.
Yeah, so I've been a member of the Board of Directors for 14 years and have had the privilege and honor of serving as the Chief Volunteer Officer for the last 9.
What does the Chief Volunteer Officer do for the Y?
So I work closely with the management team and, more importantly, our volunteer board of directors to develop and implement policies and strategies as it relates to our mission and impact on the communities.
So the Y, as I think of it from my history of the YMCA, is a place where youth go to have fun. There's usually gyms, there's sports leagues and activities. But before we went on camera, you and the gracious staff here were showing me around and telling me a lot about the other programming. What would you say if you had to encapsulate it? What is the Y's mission? What is it here to do for the community?
Well, so first and foremost, right, it is to fully serve and impact each community where we have a physical presence. And that presence is in the form of our actual facilities, but more importantly, the programming that we offer to teen, youth, and our older membership.
So the Greater Y of Michiana is the title of the organization. I understand that you employ over 500 people at your various locations. Let's talk about the locations. We're here at the Niles facility, which is a very large and sprawling facility. We're going to get a little bit into what this room is that we're standing in, but there are other facilities. Let's talk about those. There's St. Joe Benton Harbor?
Yep, that's correct. We have a facility in Benton Harbor, St. Joe, which is on Hollywood Road, just off of Niles Avenue. We have our facility in South Bend, which is currently at the O'Brien Center, and then we have Camp Eberhart, which is located on Corey Lake in Three Rivers.
Okay. So those 4 facilities that make up the Y of Greater Michiana, and that is something that you're seeing as far as the Y is concerned, that instead of a Y being necessarily located in just one community, that there's a regional symbiosis to be had.
Yeah, and George, quite frankly, that's the reason behind our growth and why we have expanded in the manner which we have over the last 10 years. So we could have a physical presence in those communities and provide a greater impact by having, again, that presence.
We talked about our show is Economic Outlook and the region's economy. We focus on what we colloquially call Michiana. What would the Y's role in our economy be if you had to categorize it?
So the simplest thing that I can point to, which I think is incredibly important, is that part of our mission and our goal is to work collaboratively with our community partners. Those community partners are not only other nonprofits, but also employers, healthcare industry, school districts, et cetera. And we have confirmed and identified that one of the greatest needs that we have in our respective communities is the need for meaningful and quality, affordable daycare. So we have wraparound services and programs that we provide before school, after school. We have summer camp programming. We have these daycare programs that we offer. And so when you look at that through the economic lens, that's how we're impacting the local economies, is by helping folks with that great need.
Yeah, and that is a huge need, especially when we talk about workforce development and the costs that some folks incur as they go back to, or they need to be at work. The Y can serve that. We said we'd come back to this room. Well, here we are. I think that's a good tie-in. This room was designed and built recently in one of your most recent expansions, and it's rather impressive. I'm sure our viewers will see some footage of it, but it is a very comforting space. What's its purpose?
Yeah, so this is our Youth and Teen Center, and again, going back to our strategic business plan and looking at the needs of the community, this was a huge void, and there was no physical space, quite frankly, for our youth and our teens to congregate. We didn't have an area to offer specific programming. So this room allows for specific programming at certain times of the day, and also an area where our youth and teen can simply congregate. So if they just finished in the gym with basketball, they're able to come here, play pool, socialize with one another, play games, and have that high level of interaction that is so important.
Yeah, to promote their health and well-being.
100%.
Yeah. Well, Mitt, thanks today. Thanks for being with me. Thanks for showing me around this great facility, and good luck with I know that there's plans to expand the rest of the facilities to have spaces like this. Jeff, back to you in the studio, where you've got more to talk about, I'm sure, about how our community partners, whether they be for-profit or non-for-profit, are coming up with unique ways to help expand and support our region's economy.
George, thanks. Appreciate the inside look there. Denise, it was great. Appreciate the chance to go see some of the facilities that you've got going there. So, Denise, let me come back your way. So, as we were wrapping up before the break, Andy was talking about just employee retention, keeping people around. Employers are really, and so health, wellness, kind of a lot of wraparound services. Talk a little bit about just sort of the whole picture, if you will, not besides health and wellness there.
Well, I think when I think of the workforce, I think we have to take care of people, and I think that's what I think about the why. We take care of people, we take care of our communities in that way, and I think that when you look at an employee, they have a lot of needs besides coming to work and doing the job that they do. So just taking care of their family and making sure that they're aware of some ways that it impacts their health, managing their stress. The Y does a lot of those things, so people can, if they have a membership, the Y, they can do that. There's also wellness programs that people can join and be a part of in the workforce, and we also collaborate with other businesses or that can help bring positive workforce health. So it's just like that wraparound and the child care factor of getting people back into the workforce and making it worthwhile to go to work and knowing that their kids are in a safe and structured environment.
Yeah, give us a feel for just quickly on the child care piece of this, for example, because I think this is something you've done well that's been really helpful for employers. Help somebody who needs that kind of service understand what you do there.
Yeah, so from infant and toddlers to after-school care, and so we have kids in after-school care that are after school. They come to the Y, and they can do different activities there, and parents can stay at work and then pick up their kids after work, which is really nice because the buses will drop them off. We also have infant to toddler, so if parents are in the workforce. So with that, the Y is just that's what they're nationally known for, is child care across the nation, and we do a really good job of that. With the education, they can also do sports and swimming and things while they're there in that program and get their homework done. So.
Andy, let me come back your way. So as we think about from an employee standpoint, and I use myself as an example of who was a customer who benefited greatly from Connie's advice. So I'm not sure I learned some of the stuff that maybe I learned when I sat down with your company, right? Like I might have remembered nutrition from a long time ago. I'm not sure that I understood how certain things affected this or that either. Talk about this, just the education piece and helping people understand or be better students of the things that can help them be healthier.
Yeah, I think that's a missing component in the education system. The health and wellness isn't really a subject that you're taught in school. You get out there in the world and you may not understand how to read a lab report that you get from your doctor. I go to the doctor and I wait for them to call me and tell me what's going on. And what we do is through that one-on-one coaching, we get a chance to sit down with the individual and have conversations with them about things that maybe they don't want to disclose to their employer. And this is all protected information when we have conversations. And it may give you some insight and some education into making some significant changes in your life for your own benefit and for the wellness of your family long term. And I think that's what we're seeing with premier employers out there, is that they're dedicated to that. I love Denise's collaborative, using the word collaboration. That's really what it's all about. You've got employers out there who recognize the retention of employees, these good quality employees that they've had for years and years. They need that little extra benefit. It'll help them be more productive. It'll help them be a healthier individual, and really just a general feel-good benefit.
Yeah, can I stay with the employee piece for a second here? So, how do employees react sometimes, right? Do they bring them to the table kicking and screaming, stay out of my personal life, I'm just here to make widgets? Or do employees welcome this? Are companies offering incentives? Just give us an employee perspective here.
Yeah, I think it is very welcomed by the employees to know that your employer cares about you in that way, and to be able to have that interaction with a nurse on a consistent basis. Initially, it's maybe a little standoffish, but they warm up pretty quickly once they understand that they're there for their benefit. And we just, even this week, we've recognized some things through some personal health assessments where we've got some blood sugar issues that are really very, very elevated, and there's some things that have been addressed just this week by one of our nurses that are going to help an individual recognize and do something about the issues that he's facing. So yeah, once there's a couple of feel-good stories and that interaction happens, it settles out pretty quickly, and people recognize the tremendous benefit of having a nurse on site.
It's interesting, as you're mentioning that, I think of the data piece. No disrespect meant to doctors, for example, but people just don't understand that sometimes, right? So through either maybe classes that Denise you have at the Y, or through the assessments that you're doing, people better understand what that data means and how to affect it one way or the other.
Yeah.
I think also an awareness. It brings an awareness to them, so then they know how does that affect me? How does that affect my family? And then how small changes can make a huge difference. So I think you even shared your story, making small changes at a time, that you do that. I love one of our programs we have is called Healthy You, and that's with our preschoolers and our after schoolers, and we talk about nutrition, we talk about go foods, whoa foods, and slow foods. And so kids go home, and I have grandkids, and so they go home and they tell their parents, oh, I can only have one of those, can I, because that's a whoa food, so just that awareness and that education, and I think that that's really good. So when you wrap that around, that's pretty awesome, and the awareness for the workforce. So.
It's interesting. I think as companies around the state are, and just an Indiana number more than anything, we know we have Michigan area, but the cost to the economy is significant. So Indiana, for example, has high smoking and high obesity rates, and those have a $4 billion annual impact on the healthcare system that's money that wouldn't have to be spent if we had a healthier workforce. And so those kind of things, both of you helping in that space as well, right?
Yeah, I think the mission is very similar. The long-term change, the better, self-improvement, those things, the one step at a time. That's really what it's all about, and over a long period of time we can make some of those significant changes through, maybe it is a specific program, or maybe it's just that awareness of what the individual may need to do.
Yeah. Denise, let's come your way, last 2 minutes here. So advice to somebody who's watching, who maybe doesn't have some of the best habits now, wants to do something different. Where do they start?
Start out just come into the Y. Come into the Y, or even if you can't come into the Y, come somewhere in your community. There's so many resources out there. Just reach out. Like I was thinking of the Stop Smoking. Indiana has a big force for that and a lot of opportunities for people to have smoking cessation classes, and we can partner with those groups. But I think if you come into the Y, we have scholarships. So even if you can't afford, you don't think you can afford a membership at the Y, we offer scholarships so everybody can be included in the Y and the Y program. So those small steps make significant changes. And as a health educator, one small change always leads usually to another small change, which leads to better health.
Yep. Last 30 seconds. What advice to somebody who wants to make some changes?
Advice.
It's like
Yeah,
go ahead.
I think really just take that first step. I mean, that's really what it boils down to. And I think from an employer perspective, if you want to be a premier employer and be engaged in the better health and wellness of your employees, it starts with finding out exactly how that works and take a look at the programs, get in depth, realize some of these goals can be achieved, and it makes a huge difference in your workforce.
Great. Guys, thank you so much for the conversation. I'm grateful to have you both.
Thank you.
Thank you.
That's it for our show today. On behalf of the entire team here at PBS Michiana, thank you for watching or listening to our podcast. To watch this episode again and any of our past episodes, you can find Economic Outlook at WNIT.org or find our podcast on most major podcast platforms. We also encourage you to like us on Facebook, follow us on Twitter. I'm Jeff Ray. I'll see you next time.
This WNIT local production has been made possible in part by viewers like you. Thank you.